Let me ask you something, and I want you to be completely honest with yourself as you answer. Have you been waking up every single morning already exhausted, even after 8 or 9 hours of sleep? Have you noticed your weight climbing steadily no matter how disciplined you are with food, no matter how often you drag yourself to the gym? Are you always the coldest person in any room, always reaching for a sweater while everyone else around you seems completely comfortable? If any of those three things resonate with you, I need you to stop scrolling, stop everything else you are doing right now, and watch this video from start to finish, because what I am about to share with you could genuinely be the most important health information you have encountered in years. And the reason I say that so confidently is because millions of people across the world are walking around right now with a malfunctioning thyroid, and they have absolutely no idea. They have been told their lab results are normal. They have been handed prescriptions for depression, for high cholesterol, for anxiety, and for pain. And not one of those prescriptions addressed the actual root cause of what was happening inside their body. My name is Dr. Lucas Whitfield, and over the course of the next several minutes, I am going to walk you through 7 of the most overlooked signals that your thyroid is underperforming. I'm going to explain exactly what is happening inside your body on a biological level when this critical gland stops doing its job properly. I am going to show you a simple at-home temperature test that costs almost nothing and can give you more useful information than a standard TSH blood test in many cases. And then I am going to give you a complete evidence-backed protocol that you can start implementing immediately whether you have an autoimmune thyroid condition or a non-autoimmune sluggish thyroid. So let us start with the basics, and then we are going to get into the 7 signs, because understanding what the thyroid actually does makes the symptoms make so much more sense. Your thyroid gland sits in the front of your neck, shaped almost like a butterfly, and its job is to produce hormones, primarily thyroxine, which we call T4, and triiodothyronine, which we call T3. And these hormones act like a master volume dial for your entire metabolism. Every single cell in your body has receptor sites for thyroid hormones. That means your heart cells, your brain cells, your liver cells, your skin cells, your hair follicles. Every tissue in your body responds to thyroid hormone levels. When thyroid output drops, the volume on your body's entire operating system gets turned down. Energy production slows. Fat burning grinds to a halt. Your brain runs at reduced capacity. Your muscles become sluggish. Your digestive system slows down. Even your cardiovascular system reduces its efficiency. This is not just about feeling a little tired. When thyroid function is chronically low, the downstream consequences touch virtually every system in your body, which is exactly why the symptoms are so varied and why so many doctors miss it completely. They see the high cholesterol and they think cardiovascular risk. They see the depression and they prescribe an antidepressant. They see the weight gain and they recommend calorie restriction. But none of those interventions address what is actually driving all of those problems simultaneously. Now let us get into the 7 warning signs, and I want you to pay close attention because some of these are going to surprise you completely. The first one, and this one is something you can check right now as you are watching, is the disappearance of the outer portion of your eyebrows. Thyroid hormones are essential for the growth and maintenance of hair follicles. When thyroid levels drop, the follicles in the outermost third of the eyebrow tend to be the first ones to stop functioning properly. This is a phenomenon that has been documented in medical literature for decades, and it is something I check on every single patient I see who comes in with unexplained fatigue or weight changes. If you look in the mirror right now and your eyebrows taper off and essentially disappear before they reach the outer corner of your eye socket, that is a meaningful physical sign that deserves attention. And this same process is happening on your scalp as well, which is why hypothyroid patients so often complain about hair thinning, hair that comes out in handfuls in the shower drain, hair that lacks the volume and strength it used to have. This is not a cosmetic issue. This is your body giving you a visible signal of a systemic problem. The second sign is one that affects tens of millions of people, and yet the thyroid connection is almost never discussed in the context of it, and that sign is elevated cholesterol. Here is why this connection matters so much. Thyroid hormones regulate the speed at which your liver processes and clears LDL cholesterol from the bloodstream. When thyroid output is insufficient, the liver slows down this clearing process, and LDL levels climb. What I find profoundly frustrating, and what I have seen happen to patients over and over again throughout my career, is that a person comes in with elevated cholesterol. They get placed on a statin medication without anyone ever checking whether their thyroid might be the underlying cause. If you have been told your cholesterol is high and you are also experiencing fatigue, weight gain, or coldness, you absolutely need a complete thyroid panel done before you accept a lifetime cholesterol medication. For many people, normalizing thyroid function is all it takes to bring cholesterol back to healthy levels naturally. The third sign is something that most people dismiss as just getting older or sleeping in a weird position, waking up with a swollen, puffy face, particularly around the eyes and the cheeks. When thyroid levels are low, a very specific process called myxedema can begin to develop, where mucopolysaccharides accumulate in the tissues beneath the skin and bind to water molecules, causing a type of swelling that does not respond to diuretics or changes in fluid intake. This is not the same kind of swelling you get from eating too much sodium the night before. This is a deeper, more persistent puffiness that tends to be worst in the morning and may improve slightly as the day goes on. If you notice this in the mirror regularly and you also experience other symptoms on this list, the thyroid connection is real and worth investigating. The fourth sign is carpal tunnel syndrome, and this is one that most physicians never connect to thyroid function, which means thousands of people are going through wrist surgeries and wearing braces at night and doing physical therapy for a condition that could be completely resolved by addressing the actual hormonal root cause. When thyroid levels are low, the body tends to retain fluid more broadly across multiple tissue compartments. One of the areas where this excess fluid accumulates is in the carpal tunnel of the wrist, the narrow channel through which the median nerve passes. When that tunnel fills with fluid, it compresses the nerve, and you get the classic symptoms of carpal tunnel: numbness, tingling, pain that wakes you up at night. If you have been diagnosed with carpal tunnel syndrome and you also have unexplained fatigue or weight issues, please, before you let anyone put you on a waiting list for surgery, get a comprehensive thyroid panel done. The fifth sign brings us into territory that is probably the most heartbreaking, because this is the one that leads to the most misdiagnosis and unnecessary suffering: depression and anxiety. Thyroid hormones play a critical role in regulating neurotransmitter production and receptor sensitivity inside your brain cells. When T3 levels drop, serotonin synthesis is impaired, dopamine signaling becomes blunted, and the mitochondria inside your neurons produce less energy. The result is a kind of biological depression that feels exactly like clinical depression, that responds to antidepressants only partially, if at all, and that comes packaged with the physical symptoms of exhaustion, coldness, and weight gain that true psychiatric depression typically does not include. Research indicates that more than half of all patients with confirmed hypothyroidism develop depression as their primary presenting symptom, and many of them spend years on antidepressants, sometimes seeing modest improvement, never understanding that the medication was attempting to correct a neurotransmitter imbalance that was itself being caused by something happening in the neck. When the thyroid is addressed and hormones normalize, the depression frequently lifts completely, and that is not something any antidepressant prescription can claim. The sixth sign is one I see constantly, and it almost always gets misattributed: chronic headaches and migraines. When thyroid function is low, muscles throughout the body tend to become more tense and slower to relax. The muscles of the upper back, the neck, and the base of the skull are particularly affected, and when those muscles tighten and stay tightened, they create compression at the cervical spine and tension across the scalp that produces exactly the kind of persistent tension headaches, and even full migraine episodes that so many hypothyroid patients report. If you have been living with chronic headaches that do not respond well to over-the-counter pain relievers, and if you also have several of the other symptoms we have discussed, a comprehensive thyroid evaluation is a completely reasonable and overdue next step. And now we arrive at the seventh sign, the one that I want to spend extra time on, because it comes with a practical tool you can use at home starting tonight: persistent coldness and low body temperature. The thyroid essentially functions as the furnace of your body. Thyroid hormones regulate the rate at which your cells generate heat through metabolic activity, and when those hormones are insufficient, your core temperature drops. People with hypothyroidism describe wearing extra layers of clothing when nobody else around them is cold. They describe cold hands and cold feet even in warm rooms. They describe feeling like they can never quite get warm, no matter what they do. This is not a quirk or a personality trait. This is a measurable physiological consequence of inadequate thyroid hormone production. And this brings me to the at-home temperature test that I have been using clinically for many years because it gives you information that a standard TSH blood test simply cannot always provide. Here is how to do it. You need a basic thermometer, the kind you can find at any pharmacy for just a few dollars. First thing in the morning, before you get out of bed, before you drink anything, before you do anything at all, place the thermometer in your armpit and leave it there for a full 10 minutes. Write down the temperature. Repeat this process on 3 consecutive mornings and then take the average of those 3 readings. A healthy resting basal body temperature should fall right around 98.6 degrees Fahrenheit or 37 degrees Celsius. If your average morning temperature is consistently below 97.8 degrees Fahrenheit or below 36.6 degrees Celsius, that is a meaningful indicator that your thyroid may not be producing sufficient hormone to maintain normal metabolic activity. I have had patients come in having already been told by another physician that their thyroid was completely normal based on a TSH test alone, and when I did the basal temperature test, their average was sitting at 96.4 degrees Fahrenheit. That is a significant gap from normal, and it tells a story that the blood test was not telling. Now let me explain why the standard thyroid test so often misses this problem. Because this is genuinely important for you to understand before you go back to your doctor and ask for more testing. The most commonly ordered thyroid test measures something called thyroid stimulating hormone, or TSH. This hormone is produced by your pituitary gland, and it essentially sends a signal down to your thyroid, telling it to produce more hormone when levels drop. Think of TSH as the thermostat on your wall and the thyroid as the furnace in the basement. The thermostat reading might look normal, but that does not mean the furnace is working efficiently. Researchers examining large populations have found that nearly half of patients tested who had a subclinical low thyroid were actually diagnosed incorrectly as having a normal thyroid based on TSH alone. Additionally, the so-called normal range for TSH has margins so wide that a person can have genuinely sluggish thyroid function and still fall within that range on paper. The typical reference range used by most labs is somewhere between 0.5 and 4.5 millunits per liter, but those reference ranges were built using population data that included people who themselves may have had subclinical thyroid dysfunction, which means the goalposts were set incorrectly from the start. If you want an accurate picture of your thyroid health, you need to ask your physician for what is called a complete thyroid panel. This should include TSH, free T4, free T3, reverse T3, and thyroid antibodies including both anti-TPO and anti-thyroglobulin antibodies. Here is why each of those matters. TSH, as I explained, tells you what the pituitary is demanding of the thyroid. Free T4 tells you how much inactive hormone the thyroid is releasing into circulation. Free T3 tells you how much of that inactive hormone is being converted into the active form that your cells can actually use. Reverse T3 tells you whether your body is shunting T4 into an inactive, blocking form during periods of stress. And the antibody tests tell you whether your immune system is attacking your thyroid tissue, which is the root cause in more than 90% of all hypothyroid cases in developed countries, a condition called Hashimoto's thyroiditis. Understanding which category you fall into matters enormously because the protocol for addressing Hashimoto's autoimmune hypothyroidism is meaningfully different from the protocol for non-autoimmune hypothyroidism. Let me walk you through both. If your antibody tests come back elevated, you are dealing with Hashimoto's, which means the primary issue is not simply that your thyroid is sluggish, but that your immune system is actively destroying your thyroid tissue. In this case, the most important thing you can do alongside working with a qualified healthcare provider is to address the immune component directly. The trace mineral selenium is something I consider essential in this context. Research has shown consistently that selenium supplementation at approximately 200 micrograms per day can significantly reduce levels of thyroid peroxidase antibodies and thyroglobulin antibodies over time. And selenium also plays a critical role in converting inactive T4 into the active T3 form that your body can actually use. This is a nutrient that is commonly deficient in modern diets because selenium levels in soil have declined significantly in many regions due to agricultural practices. The second pillar for Hashimoto's management is vitamin D3, and I cannot overstate how powerfully this single nutrient influences immune regulation. Vitamin D functions less like a vitamin and more like a hormone in the body, and it has profound effects on the regulatory T cells that keep autoimmune activity in check. There is a body of clinical work, most notably associated with the protocol developed by Dr. Coimbra, that involves using higher therapeutic doses of vitamin D3 under medical supervision with appropriate cofactor support to drive down autoimmune inflammation in the thyroid. I want to be clear that higher dose vitamin D3 supplementation requires monitoring by a qualified clinician, so this is not something to self-prescribe without guidance. But the underlying principle of ensuring adequate vitamin D status is something every single person with an autoimmune condition should take seriously. When you are supplementing with vitamin D3, you should also be taking its essential cofactors, which include magnesium, vitamin K2, and zinc, because these nutrients work together as a system. And vitamin D supplementation without adequate magnesium in particular can create imbalances elsewhere. Removing gluten completely from your diet is another intervention I recommend strongly for anyone with confirmed Hashimoto's. The structural protein in gluten, called gliadin, has a molecular structure that resembles thyroid tissue, closely enough that in genetically susceptible individuals, the immune response mounted against gliadin can cross-react with thyroid cells through a process called molecular mimicry. This is not a fad diet recommendation. This is established immunological research, and the clinical improvements I have observed in patients who remove gluten completely from their diet within the context of Hashimoto's management are consistently significant. Adding intermittent fasting as a practice is also enormously beneficial for reducing the underlying inflammatory burden that drives autoimmune activity. And it has the additional benefit of improving insulin sensitivity, which brings me to something I want to address for both groups, Hashimoto's and non-autoimmune hypothyroidism alike. High insulin levels caused by consistently high carbohydrate intake directly suppress thyroid function. Elevated estrogen, whether from endogenous hormonal imbalances, hormone replacement therapy, birth control pills, or environmental estrogen exposure through soy products and certain plastics, also suppresses thyroid function. And chronic psychological stress elevates cortisol, which suppresses the conversion of T4 to T3 and drives T4 into the reverse T3 pathway instead. So dietary choices, hormone balance, and stress management are not optional lifestyle additions when you are dealing with a thyroid problem. They are foundational biological requirements. Now, for those of you who do not have elevated antibodies and are dealing with straightforward non-autoimmune hypothyroidism, selenium is still essential. For the T4 to T3 conversion reason I mentioned, zinc is another mineral that plays a direct role in thyroid hormone synthesis and receptor function, and deficiency in zinc is remarkably common in people eating processed food-dominant diets. Magnesium is involved as a cofactor in dozens of enzymatic reactions that support thyroid hormone metabolism. Iodine is a nutrient that requires particular nuance in this context. Iodine is a literal building block of thyroid hormone, since T4 contains 4 iodine atoms and T3 contains 3. However, excessive iodine supplementation in the context of existing thyroid dysfunction can actually worsen inflammation, which is why I strongly recommend iodine testing before adding iodine supplementation rather than just assuming that more iodine means better thyroid function. There is one more piece of this puzzle that most practitioners overlook almost entirely, and that is the liver and gallbladder connection. The conversion of inactive T4 into active T3 happens primarily in the liver. If liver function is compromised through fatty liver disease, inflammation, or poor bile production, that conversion process becomes inefficient. People who have had their gallbladder removed often develop a bile deficiency that significantly impairs fat-soluble nutrient absorption and liver-based hormone conversion. If you fall into this category, adding bile salt supplementation taken with meals can meaningfully improve your body's ability to convert thyroid hormone into its usable form. This is one of those interventions that gets almost zero attention in mainstream medicine, but makes a substantial difference for the right patient. I want to close with a message to anyone who has been dismissed, who has been told their results are normal when they know something is wrong, who has been handed a prescription when they needed a root cause investigation. Your experience is valid. The disconnect between how you feel and what a single blood test shows is real, and it is a gap that a more comprehensive, more curious, more patient-centered approach to thyroid evaluation can close. Do the basal temperature test I described. Ask for a complete thyroid panel. Understand the distinction between Hashimoto's and non-autoimmune hypothyroidism. Reduce refined carbohydrates. Manage your stress. Consider the selenium and vitamin D3 protocol I outlined. Remove gluten if your antibodies are elevated. Support your liver and bile acid production if needed. These are not complicated interventions. They are systematic, evidence-supported steps that address the actual biology of what goes wrong when the thyroid underperforms. I have watched patients reclaim their energy, lose the weight that would not budge for years, come off antidepressants they had been told they would need indefinitely, and simply feel like themselves again, sometimes within a matter of weeks, after years of being told there was nothing wrong with their thyroid. That transformation is what this work is about, and if this video gave you even one piece of information that helps you ask a better question or take a more targeted step toward your own recovery, then it has done its job. If you found this valuable, please subscribe to the channel so you do not miss the follow-up video, where I go deeper into the specific lab ranges to look for on a complete thyroid panel and exactly how to have the conversation with your doctor about getting the full testing done rather than just the standard TSH. Hit the like button, leave a comment below telling me which of the 7 signs resonated with you the most, and share this video with anyone in your life who has been struggling with unexplained fatigue, weight gain, or coldness without ever being told their thyroid might be the reason why.